Hello, my name is Rachel Cole, and I chose to do my project on VA healthcare reform because that's something that's very important to me as a veteran. I feel like our healthcare is really lacking, and from what I've seen personally, I think that it's a problem within the institution, not necessarily a budget problem itself, like Congress and the President seems to think. I started off with my paper talking about the VA and how it came to be and, the establishment of the VA hospital itself. And then I went into some of the issues with the VA healthcare reform that President Obama tried to illustrate. He, first of all, established a $16 billion budget increase for the VA hospital, which meant that, they could hire more people. But even though he established that in 2014, it still did not increase any changes within the VA healthcare reform policy. I also went on to talk about a few congressmen's take on VA healthcare reform. One congressman decided to do his own survey. It went on for a year, and he asked 1,200 veterans how they felt about their healthcare, and he found out that most of them decided to seek outside healthcare because the VA was just not cutting it for them. Within the VA, since everything pretty much relies on your primary care provider and their team, you really have to make sure that you are scheduled for appointments, which is something that, even though the VA should take on itself, it doesn't, from what I've seen and from what most of my veteran friends have been through. Sometimes we get lost in the system and appointments are not scheduled, and sometimes your primary care provider forgets to put in outside consultations if the VA can't take you on. So President Trump has tried to establish a new bill, which hasn't passed through yet, but hopefully it'll make its way through, that holds not only your primary care provider responsible, but it also holds the secretary of the VA responsible, the director of the VA hospital that you're at responsible for not scheduling your appointments. And I think that this is something that's really important because it shouldn't just be one person responsible when it's the whole system that has a flaw. Some congressmen have been fighting for choice care for veterans, which means that you can go out into the economy through a provider that the VA chooses to get your health care, and that is a good thing because sometimes the VA just cannot take you on, and you have to seek outside help in order to get care. But, some congressmen have had an issue with this because of the budgetary constraints, so it's still trying to get passed through exactly how far they're willing to take that partnership with outside community resources and what they're willing to keep in the VA, because if the VA doesn't get enough money, then they will close down, and then there won't be care for veterans. The main argument that I stated in my paper is that you can increase the budgets all you want, but it definitely won't have an effect if there's no reform from the inside, which means that the hospital staff has to be reformed, and primary care providers have to be held responsible for following through what they say that they're going to do. So that is what my paper is about, VA healthcare reform, and how it really hasn't been reformed, but hopefully the Trump administration and Congress will find a way to get around that. Reform doesn't happen overnight, but if you plant small seeds, then hopefully people will get the right idea and things will change.